Dr. Chalapathi Rao had a strong sense of personal social responsibility.
बोला बोला डाउन करा
next slide.
Dr. Nande, just click on the slide and then the down key. Just
yeah
and then the down key.
not advancing. Okay. Okay. Here.
This is a slide to show how a little known hamlet in a model village is converted from Ibrahimpur village in Andhra Pradesh. A remarkable thing, students can sit, how to take my, students can sit in the classroom to eat, to study, for state of audio, art, audio visual facilities, electricity for villages, and a crematorium, and also a shed for prince's cattle. I selected my talk, the path I chose that made all the difference in life. On 31st of July 1943, I came back from school with a fever that lasted for 47 days. The treatment was cold sponging for high fever and hot water bath for shivering. Only glucose water was allowed as food. It was reduced between skin and bones, but surprisingly, I survived. Our family physician, Dr. Chhatre, was our savior. Dr. Prof, therefore, attracted me. And my obstacles, I had a small town mentality, beggar at that time at a population of 40,000. My career was average, and my trouble with speech defect just did not left me. I never had any dreams or the great achievements in life. I was under the impression that success needs a good academic career, influential social contacts, impressive personality, and command of English. I was wrong. Achievements have hidden seeds of success in life. I evolved a technical local anesthesia while I was a surgical and GT hospital. I performed many operations independently, though I had not passed my MS. The idea is find solutions to problems. Do not waste time in complaining. And what was the fallout? In 1959 in England, the patient with hernia, a pain recovered from MI. I operated on him under local anesthesia, and the news was all over the hospital the next day that this young Indian surgeon had done a remarkable thing. In 1970, the first survival after a rupture operation due to hospital. Later, many elderly patients with hernias, including a 106-year-old man, declared unfit for operation, took my name all over. I want young people to understand the merit of a technique does not depend only on how you treat uncomplicated problems, but more so on how you manage difficult situations. And in 1994, I operated on our president for a large recurrent hernia going up to the knee joint. Time taken was 3 hours and 40 minutes. Hospital stay for 4 days, but our stay in Rashtrapati Bhavan was for 18 days because he developed a massive seroma, which was taught as a recurrence. He was advised by the Prime Minister to go abroad. So I said, why did not go, sir? He says, with what face can I tell the world that our surgeons are competent? Vinod Rawal, president of the Gujarat chapter surgeon ASI, he says, I have known Dr. Shrikhande since 1956 when I was a house surgeon and he was a registrar. He was the first registrar in Bombay who did major emergencies alone. I've seen the development with wonder. has glorified the art and science of surgery. He is a legend who has followed the path chosen by few and earned respect in our country. I had a long time to work with. From 54 to 25 years, it was Sherlock Holmes era of clinical judgment. We took history in detail, test the patient, observe the patient, and clinical approach still remains very useful for acute abdomen. After 1979 came the James Bond era. Treat the reports. It's a global phenomenon, not only in India, it's happening all over the world. Dr. William Osler, who brought the bedside medicine, father of modern medicine, must be restless in his grave to see the disconnect between the patient and the doctor. However, technology is a great advance in diagnosis of gallstones and pancreatitis and GI cancers, there's no doubt. Here's the interesting case you want to see. Operated for acute appendicitis on 18th of December 17. This is the 33rd anniversary. On 21st of December, she developed intestinal fistula. She was tried to close the fistula on 2 occasions, the attempt failed, and was referred to me on 3rd of January 1979. She came to me with abdominal skin completely ulcerated. Foul smelling, discharge, bulky dressings, fever, and toxic-looking patients. She had lost 10 kilos of weight within 15 days' time. What did we do? We said remove the nasogastric tube and let her eat everything. She was eating 21 white of eggs every day. Bulky dressing was done. I said, don't do any dressing at all. Let the relation, husband and the 3 kids, sit by side and do continuous suction of the discharge that came out. And you see here what nature can do. The wound healed completely without a single dressing, gained 7.5 kilos of weight in 27 days. I want you to remember that TP is available, but oral nutrition is safe and effective. Birth of a GI specialty. I brought my first gastroscope in 1979. Orientation was difficult. I had to become a self-taught endoscopist. I imagine I was entering the patient's mouth with my chin over the dorsal of her tongue, and then, my God, everything became so clear. I got references from all the 4 government hospitals. They were never charged. Best resident joined my unit, and a specialty was established. I did the first gastrectomy, first diagnosis of stomach cancer in 1979. And here you can see the ulcer there. This patient greeted me on 31st of December, exact 20 years. I'm alive, no words to thank you. There was no time for me, it was time for technology. Gallstones were never suspected in males before ultrasound era, because the concept was fat, fair, female for 40. Here, a young man suffered because he was treated as a intractable during the ulcer, repeated hospitalizations, even a teeth was extracted, removed the septic focus. We explored him, we had no diagnosis, I think the pain is genuine, and here you find a gallstone with chronic cholecystitis. I taught my students on that if your patient with peptic ulcer does not respond to antacid, think gallstones. And the medical student with me, he says, so my father is not well. He brought him, he also had gallstones. There was another case of gallstone of a well-known literary man from Maharashtra. As he did not respond to treatment, he was operated by a senior man with vagotomy and gastrostomy. Still, the patient did not improve. I said, this man must be explored. And what we found was the large gallstone with a cholecystectomy fistula. patients suffered because of treatment and wrong diagnosis. Cholecystectomy is a simple operation if not followed by complications. Located first cholecystectomy, I did my first gallbladder on 19th of June 1959. The problem is say for liver blood, so what we did was to infiltrate the liver blood with saline adrenaline. Here was a man, young boy of 17, repeated attacks of pain, jaundice, and fever. He was treated hepatitis, but I did PTC. We had just started doing it at that time and saw that there's a, there's a stone in the lower part of the combined duct. See what ultrasound has done. Here was chronic pancreatitis. A young boy suffering from abdominal pain from childhood. But with repeated treatments, even appendectomy was done. The pain continued. He was going ECTs. Can you believe it? And still he was not getting better. Thrashed at home and was thrashed at school. He had, you see here, chronic pancreatitis. But it was not so surprising because in 1971, I got to see work of Rodney Smith, was known to be a pancreas surgeon of great repute. I saw 7 negative laparotomies in this unit within 4 days. I said, how did it happen? So Rodney Smith tells me, what can I do? Laparotomy is the only way to diagnose or explore chronic pancreatitis. We started getting cases of pancreatitis from all over the country, and Bombay Hospital became a referral center for acute pancreatitis. This was a colony nursing home where 2 reputed people, Dr. G.M. Phadke, a surgeon, and V. Shrikhande, a gynecologist, for middle and lower class patients, where I worked for 12 years. I performed the first people operation in the small hospital of 15 beds in 1974, and the patient lived. I built my hospital building. I took old building and raised 2 floors and established in 1977. Hundreds of observers and large number of residents have been trained not only in the technique of surgery, but also in the philosophy of human touch and trust for the sick. I told them what is done in the interest of patients is ethical, everything else is unethical. Never underestimate what one man can do, what one experience can teach you, what one book can teach you, and what one lecture can teach you. I'm not a writer. I used to teach from 1963, but in 2009, I wrote a book, and it became a bestseller for 18 weeks, got 6 awards, one from America. And then I wrote in English, some were translated. This was Bangalore. I got Oration in 1983. And on my 75th birthday, some 16 years back, my students, residents, and colleagues wrote a book upon me. You all must know about Rendra Tongkar, who passed away last year. He was the president of the World Federation of our rural surgeons. He wrote down, on his advice in 1975, both I and my wife closed down our hospital and went to Bombay and spent 15 days with him. I could not believe that in a small nursing home with OT, hardly 10 feet by 10 feet, ordinary lamp and no boss apparatus, he demonstrated vagotomy and pyeloplasty with only 1 assistant. The steps he demonstrated in his operation were so simple that a rural surgeon like me was completely changed within 2 weeks. So she could advise that my anesthesia wife should accompany me was excellent education for my wife. I met large number of surgeons all over India trained by VNS. So he says, Prof. Shrikhande changed my entire life. Prof. Kare, a well-known journalist afterwards, a small place, Srirampur. Dr. V.N. Shrikhande demonstrated an ordinary setup, excision of mixed powder tumor with anesthesia under ordinary lamp. All branches of facial nerve were demonstrated. There were no nerve stimulatory cortex. I was to start with the general surgeon. Here is Madhav Dixit, a leading cardiologist from our town, Belgaum. Dr. Shrikhande, a big thanks for you for all the guidance and help that keep motivating us to. You are a beacon of light in this world which is turning black. This is my town. And this was my home childhood. Without electricity, we had to bring water from well, and toilet was still far away. This is the way we lived in life. Here was Dr. Satyendra. I went to Bombay after working as assistant professor of surgery at the South. I was thirsty for good academic work, came to Bombay, and was amazed that he between Dr. Shrikhande was dealing with major complicated problems. He himself performed PTCs with Shiva needle with the help of obsolete screening machines in dingy X-ray rooms. This was long before ultrasound and ERCP. I worked with him for 10 years and tried to follow his example. Here was a student from doctor from Erlangen. I joined medicine to serve the sick. I had a high quality of education in my own country, but I was missing something. I spent 3 months with you and I met a teacher I was searching for. Science and skill coupled with human touch is an admirable combination. Here is well-known Prabha Yadav. She was the professor and chief at plastic surgery at the Tata Memorial Hospital. She was a past president of the Association of Plastic Surgeons of India. I saw you doing vasostomy and hypospadias. I was a general surgeon. Your delicate handling of tissues was stimulus for me to choose my specialty of microvascular work. You feel happy in life. People were trained by you. Here is Lalit Kapoor. You must have heard his name. President of the Federation Association of Medical Consultants. He sent me a greeting. I had the good fortune of being a student of Dr. Shrikhande since 1964 at the Grand Memorial College and a resident doctor and PG student at GT Hospital. When you talk about Dr. Shrikhande, the images that are invoked are that of a great surgeon, a passionate teacher, a philosopher, a humanist, a compassionate doctor, a consistent friend, a reliable guide and outstanding human being, a man from whom I imbibed mythical values. May you continue to inspire many more young generations of students and serve as an icon, a role model for you too. Here is my resident from Bombay for 4 years, Vrishali Patil, now at transplants in Pune. He is a young patient, I think 4-year-old patient, whose mother gave her a transplant. It's because of your mentoring and support I am in this position and happy. For N.M. Prabhu, President of Karnataka chapter of ASI in 1984, demonstration of basic aspects of gastroscopy and biliary surgery with remarkable surgical skill had led you to that well-deserved position among surgeons. He is my student Krishna Katneshwar. He is now known as Shrikhande Marathwada. I lost my father with acute pancreatitis in 1971 when he was 42. I was 11 years old. No treatment was possible in Parbhani. My mother wished me to be a doctor, and that to a pancreas specialist. It was our luck that we got a guru in Dr. Shrikhande. Besides surgery, I learned what is empathy, social commitments, concern for the poor, and professional integrity. Katneshwar was decorated with Parbhani Bhushan. Here is, Raman Goyal, immediate past president of IGS. We are proud of our association. We are named our daughter Shreya after Shrikhande Clinic's name, Shreyas. He is a remarkable couple. Professor Dilip Kittur, who was chief pancreatic transplant surgeon in Johns Hopkins, and his wife Smita Thakur, chief of dementia program at Johns Hopkins. He wrote to me in 88, in each country, occasional surgeons set themselves aside from other surgeons by virtue of their capacity to establish schools of surgery. And more importantly, passed on to younger generations. Dr. V. Shrikhande had trained many excellent surgeons, and the setup here is an example for people mainly to follow. I feel very happy that people who are trained became later on well-known surgeons all over the world. And his interest said, here is Dilip Kittur and his wife. They had a private plane. And they took me in the private plane from Cincinnati to Dayton. She was the pilot and he was the guide. I introduced well-known surgeons to people to India because let them come and let Indians be trained by them. I was with him in 82 in Hamburg for 1 month, trying to do endoscopies and laparoscopies things. Dr. Anand Nandev was trained by him. Dr. Anand Nandev introduced therapeutic endoscopy, laparoscopy, attracting research observers from near and far, innovating, enhancing, and enriching his work of Shrikhande for 30 years. Amit Bahadev, whom you saw yesterday, and with Vipul Rathod, who are international reputations, were trained by Dr. Nande at our small clinic. Here I met a remarkable man, Professor Buechler. He invited me for a conference and we became friends. He came to our house. We have some nice wine here. See what one man can do. Professor Buechler, Professor Fries, and my son, Dr. Shrikhande, is now called as Professor Shrikhande, Deputy Director of Tata Memorial Hospital, Professor Head, Division of Cancer Surgery, and Chief Gastroenterologist and HP Surgeon. Here's a slide out this called that the tradition continues. Serve a common man. He is serving a common man Tata Hospital. So what we said is continuing now. I have done many work in life, but because I've got a fantastic family, she is my wife. She was very intelligent, doctor, but because of my work and my no attention at home, she looked after her own home, and our children, our son-in-law, have made me so happy today. And my father, the day I passed the first year, he sent me a telegram. Be an extraordinary surgeon for a common man, for an ordinary man. My parents from whom I learned how to lead a meaningful life. My mother was illiterate, and still she was very wise. Mission statement, everybody must have a mission. I want to be thoroughly used up when I die, for the harder I work, the more I. That's why at the age of 91, I still do work. I rejoice in life for its own sake. Life is no brief candle to me. It's as lost to a splendid torch which I have got hold on for the moment, and I want to make it burn as bright as possible before handing it on to the future generations. This is by George Bernard Shaw. So to you all, I have given you my torch in the hand. Go and do great work in life. Dhanyavad.
Thank you very much, sir, for this exemplary, extraordinary oration that you have delivered. And you are certainly a living legend. And it is such a pleasant coincidence that the mission statement that you have put up was the mission statement that was delivered by my father during his presidential address in 1994. So my family feels blessed that you have given this oration, and I'm very grateful to the National Executive Committee of the ASI for giving me this distinct honor to chair this session and introduce my father. Thank you, sir.